What if I told you that the one thing your doctor never discusses in your appointment, the one thing society taught you to feel embarrassed about, is literally the difference between you dying of prostate cancer or living a powerful, healthy life past 80? What if the single most natural biological function your body was designed to perform regularly is the exact thing you stopped doing? And that decision, that one quiet, ignored decision, is silently destroying your prostate, your hormones, your heart, and your mind right now, today, as you watch this video? What if older men who simply understood this one medical truth lived longer, thought sharper, loved deeper, and felt stronger? Not because of expensive medications, not because of painful surgeries, not because of complicated treatments, but because of something their own body already knows how to do perfectly. Stay with me, because what I am about to share with you in the next few minutes will completely change how you think about aging, about your prostate, about your health, and most importantly, about yourself as a man. This is not embarrassing. This is survival. This is science. And this is the conversation that could literally save your life today. What if the most dangerous thing an older man can do for his health has nothing to do with smoking, nothing to do with poor diet, nothing to do with lack of exercise, but everything to do with something so natural, so biological, so deeply human that most men over 50 have simply stopped doing it, without ever realizing the catastrophic consequences silently building inside their bodies every single day? I want you to sit with that thought for a moment, because what I am about to explain to you is not based on opinion. It is not based on social media trends. It is not based on anything controversial or inappropriate. It is based on hard, peer-reviewed, medically validated science. And it is information that every man over the age of 40 absolutely deserves to hear clearly, confidently, and without shame. We live in a world where men are taught to ignore their bodies. We are taught that asking questions about sexual health is weakness. We are taught that certain conversations are inappropriate, embarrassing, or unnecessary. And because of that cultural conditioning, millions of older men around the world are suffering from completely preventable health conditions: prostate disease, hormonal collapse, cardiovascular decline, cognitive deterioration, all because nobody gave them this simple, critical, life-saving information. So today, that changes. Let us begin with the prostate, because this is where the story starts. And for many older men, this is where the most urgent danger lives. The prostate is a small, walnut-sized gland located just below the bladder in men. Its primary function is to produce and store prostatic fluid, which forms a critical component of semen. Now, here is what most men do not understand, and what makes this conversation so medically important. The prostate is not a static organ. It is a secretory gland. That means it is constantly producing fluid. It produces this fluid whether you use it or not. It produces this fluid whether you are 25 or 75. It produces this fluid every single day of your life. And when that fluid is not regularly expelled through ejaculation, it does not simply disappear. It accumulates. It stagnates. It sits inside the prostate gland, thickening, concentrating, and creating an internal environment that becomes increasingly hostile to the healthy cells surrounding it. Think of it this way. Imagine a pipe in your home through which water flows regularly. The pipe stays clean. The pipe stays functional. The pipe stays healthy. Now imagine that same pipe where water stops flowing. What happens? Sediment builds. Bacteria grows. The pipe begins to corrode from the inside. The blockage worsens, and eventually, that pipe fails completely, causing damage that spreads far beyond the pipe itself. Your prostate, in the absence of regular ejaculation, works in exactly the same way. The stagnant prostatic fluid creates the perfect biological environment for chronic inflammation. Chronic inflammation in the prostate leads directly to a condition called chronic prostatitis, a painful, frustrating, quality of life destroying condition that affects millions of older men who have absolutely no idea what caused it. They blame stress, they blame diet, they blame age. But the real answer, the medical answer, was sitting quietly in a conversation nobody was willing to have with them. And prostatitis is only the beginning, because stagnant, inflamed prostatic tissue does not stop at inflammation. It progresses. The chronically inflamed prostate begins to enlarge, a condition clinically known as benign prostatic hyperplasia, or BPH. This causes urinary urgency, incomplete bladder emptying, weak urine stream, nighttime urination that destroys sleep, and a constant, exhausting awareness of a body that is slowly losing control. And still further, in some men, chronic cellular damage within the prostate becomes the precursor to something far more serious: prostate cancer, the most common cancer among men worldwide. A cancer that kills hundreds of thousands of men every year. A cancer that, in many cases, had a simple, biological, natural prevention strategy that was never discussed. Now let us talk about the research, because the evidence here is not subtle. A landmark study published in the Journal of the American Medical Association, one of the most respected medical journals in the world, followed over 29,000 men over an 18-year period. The findings were extraordinary. Men who ejaculated 21 or more times per month showed a 33% lower risk of developing prostate cancer compared to men who ejaculated only 4 to 7 times per month. 33%. That is not a marginal difference. That is not a statistical footnote. That is a massive, clinically significant reduction in cancer risk, achieved through a completely natural biological process that costs absolutely nothing and requires no prescription. But here is what is even more important for older men specifically. Because many men hear this research and assume it applies only to younger men in their peak sexual years. That assumption is medically incorrect and potentially dangerous. The research shows that the protective benefits of regular ejaculation are actually most significant in men over the age of 50. Because this is the age group where prostate fluid accumulation accelerates. This is the age group where hormonal changes create the most internal vulnerability. This is the age group where the difference between regular and infrequent ejaculation has the most dramatic impact on long-term prostate health outcomes. Let us now address the hormonal reality, because testosterone is not just about sexual drive. Testosterone is a master hormone. It regulates energy, mood, muscle mass, bone density, cognitive function, cardiovascular health, and immune system strength. In older men, testosterone levels naturally decline. This is a biological reality. But what most people do not understand is that this decline can be significantly accelerated by infrequent ejaculation. Now let us talk about the research, because the evidence here is not subtle. A landmark study published in the Journal of the American Medical Association, one of the most respected medical journals in the world, followed over 29,000 men over an 18-year period. The findings were extraordinary. Men who ejaculated 21 or more times per month showed a 33% lower risk of developing prostate cancer compared to men who ejaculated only 4 to 7 times per month. 33%. That is not a marginal difference. That is not a statistical footnote. That is a massive, clinically significant reduction in cancer risk, achieved through a completely natural biological process that costs absolutely nothing and requires no prescription.